We all want to be healthy, right? But what does healthy actually mean? And maybe more importantly, whose job is it to make sure we can all get there? Today, we're going to dig into the government's role in health, and you'll see it's a story of a system that's deeply divided.
So, when you hear the word health, what's the first thing that pops into your head? For a lot of us, it's probably food, right? Is a healthy country just one where everyone can get good, nutritious food?
But hang on, what if it's something even more basic? I mean, what about the water we drink? Or just the cleanliness of where we live? How much does our environment actually dictate our well-being?
Or heck, could it be as simple as the air we're breathing in right now? You can see how fast this gets complicated. Being healthy is clearly a lot more than just not being sick. It's about, well, everything around us.
Okay, so let's try and get on the same page. What are we really talking about when we use the word health?
It's really easy to think, oh, I'm not coughing, so I must be healthy. But it goes so much deeper than that, doesn't it? True health is about being free from illness, sure, but it's also about having the energy to be active and feeling good in your own head, you know? Not being under constant mental strain. It's the whole package.
All right, with that bigger idea of health in mind, let's dive into a really fascinating and, frankly, pretty tough case study, the healthcare paradox in India.
So here's the central puzzle. On one side, you have India, a country with tons of doctors, clinics, and some really advanced medical tech. But on the other side, that same country is struggling to give basic healthcare to millions and millions of its own people. How can both of those things be true at the exact same time?
To really wrap our heads around this, we've got to make it personal. So we're going to follow a story about two friends who see this whole divided system up close. Let me introduce you to Amin and Ranjan. They're good friends, but their families come from completely different financial situations. And when they both get hit with the exact same viral fever, the journeys they take to get better could not be more different.
So first up is Ranjan. His family is pretty well off, so the minute he gets that fever, his dad whisks him away to a brand new, super clean private hospital.
And listen to how Ranjan describes it. He literally said he thought it was a 5-star hotel. His dad told him, well, that's what you get at a private hospital, the best of everything.
But that kind of service definitely comes with a price tag. Before a doctor even looks at him, his dad has to shell out 500 rupees, and that's just the fee to get in the door.
Now, let's flip the coin and follow Aman. His reality is a world away. He ends up at a huge government hospital, and the first thing he's greeted with isn't a friendly receptionist, but a long, crowded, and probably very slow-moving line.
Amon's experience is just about getting through it. He felt so sick he had to lean on his dad the entire time they were just waiting. The test results? They took 3 whole days to come back, but, and this is so important, the entire difficult experience cost his family almost nothing. So these two stories, Aman's and Ranjan's, they just perfectly lay out the two parallel worlds of healthcare. Let's really break down the core differences between these public and private systems.
Okay, it really boils down to this. Public health services are run by the government. They're funded by our taxes, and their main goal is supposed to be providing quality care to every single citizen. The private system, on the other hand, is a business. It's owned by private companies, funded by what patients pay, and its primary goal is to make a profit.
And that single difference in their goals, public welfare versus private profit, has huge, huge consequences, especially when it comes to the financial hit a family has to take.
So why does private care get so expensive? Well, a few reasons. They're usually in cities, which costs more. Medicines can be really pricey. And sometimes, let's be honest, there's a push to do extra tests to make more money. The result of all this is pretty staggering. Only about 20% of people in the country can actually afford all the medicines they need.
Okay, I'm just going to put this number up here and pause for a second. 40%.
That's right. 40% of people who get admitted to a hospital have to either borrow money or sell their belongings just to pay for it. For almost half the people, one sickness could be what pushes a family into a financial crisis.
This all brings us to a much bigger, more fundamental question, doesn't it? A question that really gets to the heart of what a government is for. It's all about equality.
I mean, India's constitution is incredibly clear on this. It says it's the primary duty of the government to ensure people's welfare and provide health care for all. The right to life is supposed to be absolute, and yet, the reality for so many people is just a world away from that promise.
And that leaves us with a really profound challenge. If healthcare is truly a fundamental right, and not just a luxury for those who can afford it, then how do we close this massive gap between the ideal and the reality for millions of people like Aman? What's it going to take to make that right a reality for every single person?